Question number 4 in the name of Deputy Colm Keaveney.
Corla, the Mental Health Act 2001 was passed by the then Minister Micheál Martin and marked a significant improvement in mental health care in this country. The objective of this question is to establish why we are experiencing a delay in the publication of the expert group report on the Mental Health Act, as I am concerned that it is impeding the human rights set out in the philosophy of that legislation. Corla, the current Minister, Minister Lynch, explained that the report was delayed for a range of reasons, but due to the lack of the publication of the assisted decision-making bill. And in January, Minister Lynch indicated that the review would be concluded in a number of months.
Thank you.
Can I ask the Minister, when can we expect a realistic timeframe for the publication and conclusion of that process?
The expert group set up to review the Mental Health Act 2001 first met in September 2012. That was originally due to report in 2013, as the Deputy has already stated. When it began its work, I made it clear to the members of the expert group that they should take an open and expansive approach and consider all issues which they might feel were relevant and necessary for a thorough review, having regard to the review's term of reference. The interim review of the Act, published in June 2012, was therefore a starting point for a much more detailed analysis of the issues. In line with this approach, the group requested additional time to consider the implications for mental health legislation of the Assisted Decision-Making Capacity Bill, which has been published, and an extension of its time frame was accordingly agreed to. The Deputy will also be aware that the review takes account of the fact that the Mental Health Act 21, despite what the Deputy says, predates the publication of the Convention on the Rights of Persons with Disability 2007. The Convention provides for a rights-based approach to disability, and certain of its articles have implications for our mental health legislation. In this context, the need to achieve a balance between individual human rights and the requirements for public safety has given rise to detailed discussion and analysis by the expert group. The Mental Health Act 2001 was introduced on a phased basis and was fully enacted by 2006. It would not be usual to have a formal, comprehensive review of legislation that has only been fully operational for less than a decade. The 2001 Act was fully consistent with prevailing approaches to rights at that time, and continues to underpin a modern approach to regulation of mental health services in Ireland. I am satisfied that the extended time frame which was necessary for the current review is not impacting on human rights issues within the mental health system. I expect to receive the expert group's final report by the third quarter 2014.
Deputy Keaveney, 1 minute.
Corla, last week the Minister indicated that the review would be ready by the third quarter, and we are experiencing delay after delay with respect to this process, and I don't see the type of urgency demonstrated by the Minister to reflect what continues to be significant human rights issues within. Minister, 80 children last year were warded on adult wards in psychiatric units across this country. It is a significant human rights issue. I mean, if you look at what has happened in Carlow and Kilkenny and the loss of life there, human rights, I'm asking you to take special attention and accelerate the publication of this. In April of this year, Minister Noonan said it was only a matter of weeks before we seen the publication of it. Why are we experiencing significant delay with respect to this? I'm asking you to give absolute clarity today so we can actually ensure that we protect the most vulnerable people who are appealing to you to put the best form of legislative base that has enshrined in it a human rights philosophy that protects the most vulnerable.
And that's the very reason for the delay. But the Deputy doesn't seem to understand that, and nor does he understand equally that right now in place we already have a Mental Health Act which his beloved leader published, as you know, as you keep telling us. And that Mental Health Act continues to be the governance process by which our mental health services are run. And, you know, we have delayed because we want to get it right, and we want to ensure that there is a comprehensive rights-based piece of legislation, unlike the 2001 Act, which, by the way, was appropriate for its time. not appropriate anymore. And I don't intend to rush this process, because above all else, when you're dealing with very vulnerable people, and the people that care for them, by the way, whom we have to care for as well, we need to get this right rather than quick.
Deputy Keaveney.
Well, I'm delighted to hear that the Minister is concerned about the staff and frontline staff that care for vulnerable people. You didn't bother at all responding to the frontline staff in Carlow for a significant reference period who had put their name to a piece of paper in correspondence to you. And you didn't really seem to actually take much action with respect to dealing or engaging with frontline staff. And it's an issue that we have pointed out here consistently in this chamber. You fail to engage, you fail to listen, you choose to whom you want to listen to because they tell you what you want to hear. But across this country, in particular administrative areas, in Galway, North County Dublin, and indeed in Carlow and Kilkenny, you're listening to the wrong people and it's having devastating consequences. And I would appeal to the Minister, rather than bat them over the head with the Vision for Change policy or people speak out or demonstrate some dissent about your approach, you just should sit down and engage with the frontline staff. You may learn something.
I met the same frontline staff on numerous occasions. When I met them first, they told me that they didn't want the unit in Clonmel to close, and they haven't changed that position. Frontline staff in this instance, as the Deputy will know, are 9 people out of 638, and the rest of them are happily working and tell me that they're doing a very good job and that the new approach is where we need to go. And there are certain people who are opposed to change, there are certain people who are resistant to change, but I keep telling them that at the end of the day, there is not an option. We are not stopping. Vision for Change is the policy of this government, was the policy of your beloved leader, and the last government as well, by the way, Deputy Keaveney, but you may not know that you're not in Fianna Fáil that long. So, you know, this is where we're going. And people have to get on board, and people have to be responsible and deal and care for the people that they are charged with caring for.
Thank you. Question number 5, the name of Deputy Pringle.
Thank you, Concorda. So this question relates to the long-term